About a quarter of all coronavirus-related deaths in the country are linked to nursing homes and senior living facilities. Staff inside say they're still at risk. Congress allocated $100 billion for healthcare in the CARES Act signed into law last month. Only $30 billion of it has been handed out. None of it has gone to nursing homes or senior living communities. Have you gotten any guidance on how the remainder of that $100 billion is going to be spent?
Most of the direction I got would apply to rural hospitals. A lot of this money is going to find its way to rural hospitals because a lot of their income at rural hospitals comes from elective surgery, and that's been shut down.
Senator Chuck Grassley is one of 27 senators, nearly all Republicans, who sent this letter to the Secretary of Health and Human Services, asking for nursing homes and senior living communities to be considered for relief funding. Specifically, they say these facilities need money to increase staffing and personal protective equipment.
It should be the first priority for protective equipment, personal protective equipment. They should be the ones getting the masks, getting the gowns, getting the N95 masks, etc.
I think there may be a misunderstanding in terms of where we fall in the healthcare continuum, meaning that people certainly are cognizant of the need for PPE at hospitals. I think people are certainly cognizant of the need for PPE at nursing homes or skilled nursing facilities.
As the CEO of Eclipse Senior Living, Kai Shao oversees more than 100 communities in 28 states. His staff is caring for residents within their individual units, including providing meals. Keeping residents safe, he says, depends on keeping a full stock of PPE.
That is a high-touch environment.
Though most facilities have closed their doors to the public, Dr. Edward Schneider says employees could be bringing COVID-19 into their facilities and need hospital-level protection.
They may work somewhere else as well. They don't get paid a lot. So to make ends meet, they have two jobs.
Shao says his people are frontline workers too, and that some of those federal dollars need to go to senior living communities.
And I hope they, understand that we are an extension of the healthcare system, like doctors and nurses, and they, provide us the same, type of assurances, appreciation, and tools to do our job.
Outside of Washington, I'm Alex Miller.